In our KWM News Zoom room. Uh, this story is so it's kind of broke over
Thank
the
goodness
weekend
Nestor's working on the budget.
because I wouldn't even know where to start with that. We're bringing on here. We have a customs officer, Eugene Egros, who is currently being quarantined, and his attorney Rachel Zuzu, who obviously represented him. You guys were able to get this case heard before the Department of Public Health and Social Services. Good morning, first of all, Gene. Good morning, Rachel.
Good morning, Chris and Sabrina. Good morning.
Good morning.
And so I saw that the court had come out with something, but what I'm curious about is if, because I read what they had come out with, why does it still look like Mr. Egros is still in quarantine with that court ruling? And Rachel, I guess you can just address the ruling, the decision that came out and what it means and why he's still sitting in the hotel.
Right. So we were anticipating that this might occur, that Mr. Egros and his family would continue to be in quarantine even after the court found pretty significant findings in our favor. Currently, what public health has in place is this 12-day test, which I understand now from talking to other people in quarantine has not been followed. But this 12-day test was actually not given to Gene, even though the court ordered it. My understanding is Gene's 12th day was on Saturday. Yesterday was his 13th day, and he should be eligible for release today, tonight, or early tomorrow morning. So my understanding, I'm going to defer to Gene, but my understanding was that public health did contact Gene sometime yesterday afternoon to try to schedule this testing. My client chose not to do the test only because it would take no quicker than 24 hours to return a result, and by that point in time he would have already been eligible for release anyway. So that's specific to Gene. I think there is a bigger problem that's going on with public health, and the court has recognized that problem, in that they really don't have these directives that are consistent and that they follow through with. So, well, let me backtrack. There is no directive. The court found that public health, as of Friday, Saturday, and even as of today, Monday, has no valid written directive for quarantine of these individuals at this government facility. So right now, they're being held without improperly. The other option that public health can take is to apply for the court's order for a directive of quarantine, and that can be extended for up to 30 days. And the point there is that they have to go into court continuously and regularly, and they have to, public health has to explain to the judge why a continued government facility quarantine is necessary. I don't know what the numbers look like today, Chris and Sabrina, you guys would know best, but as far as I saw, I don't think that there were any positives that were found in quarantine in the last few days. So how effective a government facility quarantine is today, that's something that public health is going to have to explain to the judge.
Right, and I think we saw this, Rach, early on where Linda, the prior director, Linda Pinco DeNorsi, actually went to court, remember? And there were all these flyers passed out to all the people who are being held in quarantine at Pacstar and the other few facilities. So I guess my question is, what changed from that point? Because it did seem like she was trying to get that involuntary quarantine taken care of through, I mean, I don't even know if that would be the proper route to do it, but it kind of sounds like, from what you're saying, that it would be.
Yes. Right. 10 GCA 19605 says that is the proper route to do it. And Linda, at that time, I believe that was back at the latter part of March, right, was getting good advice from somebody because that was in accordance with the requirements under this emergency health powers and
dun, dun, dun!
Superpowers.
Superpowers. Say superpowers, Rachel. Say
superpower.
It. Yeah.
Unchecked. This is why the courts are there, so that the court can continuously check them
Right.
when need be. So
Well, now
yeah,
that,
I think that the court's order was very, very clear that public health at one point did comply with the legal requirements. And after it did so in March, it thought, okay, well, we've already gotten one approval. I think that's enough. And then
mm,
they continued to do these quarantines without notice to anybody who was going into them.
and let's just go over to Gene now. Gene is a customs officer, and Gene, let's just take us back to the beginning. You took an off-island trip, returning to Guam with your family. Did you guys have the negative COVID-19 test results in hand when you arrived home?
Yes, we did, Chris. Chris, before we proceed, I like to mention something. The media continues to portray me. I mean, the media continues to say, "Well, I'm customs officer." Okay, I filed this petition on behalf of myself and my family. I'm not filing this petition on behalf of my position as a customs officer. So let's, I want to clear that up. The media has made it look like because I'm a Guam customs officer that I'm entitled to certain entitlements. But I want to get it straight. I filed as a citizen, as on behalf of myself, my family, and everybody else who's affected by it.
Right. And Gene, when you talk about how the media has framed it, I know that that's not us because we haven't covered this until now, but I only brought it up as an example because I see that we're giving these nonsensical exemptions to people who are less essential than a customs officer. So that's why I'm just saying you're a customs officer, because we gave a pretend exemption to a make-believe farmer who was politically connected. A make-believe farmer who only got his bona fide farmer certification a month before he left island. So I just see a clear and blatant abuse of this exemption policy. And I mean, I don't know, what you do with customs and if it's essential. I'm just merely saying that, hey, we got a guy who I think it could be argued that he's maybe, I don't know, essential. Protecting the border, it kind of seems essential, especially with the COVID. But that's why I was bringing that up, Gene. I understand that you filed this on your, as a regular person.
Chris.
Yeah.
I understand, but we understand. We all understand. Between the four of us on the show right now, we understand. But there's people out there in the public, that don't understand that. They're just going to continue to make me look bad. It's just not right.
So what happened, Gene, and what provoked you to file this lawsuit?
Well, because before leaving California, I made contact with one of my contacts over at Homeland Security. I asked, hey, what's the procedure? Right now when we come back to Guam, how can I get quarantined at home? And my contact says, hey, get a test at least 3 to 5 days before you arrive with a negative result, and you can get quarantined at home. I said, okay. I did that process, arrived here, presented public health with my results, and they just said, it doesn't matter if you have a negative result, you're still going to get quarantined.
What was your reaction when they said that to you?
Oh, I was really upset, Chris. However, I had my family with me. I didn't want to create a scene, especially, in my position as well. I just, I did what I had to do to get my family, to the hotel. We've been traveling many hours. They haven't eaten. They don't serve food on the plane. They only serve snacks. We've been traveling for 12 hours. They're hungry. They're tired. They want to go home. So, I just needed to get my family to a hotel or wherever it was, get them settled in, and then take it from there.
How many family members are traveling with you, and then what's the accommodations? I got it. That's not even the right word. But are you guys all in one room?
Well, Chris, can I just jump in
Yeah,
here?
please, Rach.
Yeah, so before Jean goes forward, that was one of the allegations that we put forth in the petition is this government facility is supposed to, or the government quarantine of travelers should be the least restrictive, and that is what the law requires. And in a family of four, like the Egros is, a 12 by 12 room is not sufficient to hold these four bodies versus Mr. Egros's home. He has a home that has separate rooms for his children, for his wife and himself, as well as a kitchen they can go to and cook whenever they'd like to. They have laundry services in the home. They've got I think a washer and dryer there. But it brings us back to, is this the least restrictive measure to keep a family, in this case, that has a suitable home where no other family member is living? I could understand if it was a multi-family home. There might be some, what is this? There might be some consideration there, but
Right.
in this case, all you're doing is cooping up these four individuals for 14 days, where every hour feels like a day in itself. So, we have to rethink this plan for a mandatory quarantine in a government facility. The court, in its decision, held, and I want to make this clear, because the court said, and I'm quoting from her, that public health chose not to follow the law. That's a pretty significant finding. Public health chose not to follow the law, and as a result, disregarded Gene and his family's fundamental civil liberties with regard to no notice. If these people get some kind of material, some notice that they're entitled to ask the court for some kind of consideration in an alternate option, which is least restrictive, public health has the legal obligation to do that, and it's not been doing it. It's been keeping these people in the dark to run these government facilities at a cost to the government. Right now, that money could be used at the Guam Memorial Hospital. I caught that very last tail end of Dr. Uggin's interview, and I thought, my goodness, it's so compelling. If people have these rooms or have homes to go to quarantine for 14 days, Mr. Egros is not trying to go out and actively infect people. Even if he did have a COVID positive test, the law presumes that our citizens are law abiding, that we want to help. We don't want this pandemic here, and we don't want the rising numbers. But to use these numbers and the death tolls as a basis of increasing fear in our community is not working. I don't know how many positive cases are coming out of quarantine, but the things that public health are doing in quarantine, they could be doing for people who are in their homes, because we've got positive cases out there in the community, and they're not being required to go into a government facility. Mr. Egros is there, and he's negative. So how much money is being spent at these facilities? I think the last I heard, sometime in August, was there was a $200,000 check to be written. I don't know, I have to take a look again, but these are all, the information is changing because it's being updated, but public health with regard to this government facility has had an opportunity to fine tune its plan and its approach since March, and it hasn't done it. And it continues to use this, well, our numbers are up and down. We don't really know what the case will be for tomorrow. Maybe that might be an appropriate response let's say in the case of Guam Memorial Hospital, because that really is a number that fluctuates based on several different factors. But I think Guam is the only, again, I have to double check my facts, but the last I checked, I believe Guam is the only US jurisdiction that has a mandatory government facility quarantine for travelers. I believe Hawaii had one a few weeks ago or sometime in July, but that was being challenged, and the Department of Justice actually filed an amicus in that case and said, hey, we agree with petitioners. This is a violation of their constitutional rights. So we get it. We're not that these people should be released into the public. We're saying we should release them into their homes if their homes are suitable to quarantine. Let's save our government some money, redirect those funds to the hospital or to other efforts that we could say works to reduce these numbers. Because to keep non-COVID people or people who at least have had some negative results locked up, it's not working.
Yeah. Gene, I'll just ask you, based on what your attorney had just said, how do you respond to those people who say, oh, this is what we got to do to protect the island from the COVID. So if you got to go in quarantine, you got to go in quarantine. Suck it up, Buttercup. Because I've seen some comments and people are saying that. How do you respond to that? Because it does seem like you do give a damn about COVID.
Oh, of course. They can respond in any way. However, I got a negative test result. Okay, the bottom line is, we all got COVID testing, and we all got negative test results. So, why quarantine me at a government facility or this hotel when I have my own home? I have a home to go to. Okay, it makes no sense at all putting me and my family in this 12 by 12 room for 14 days. It makes no sense at all. And we have a negative test result. I can understand if we didn't take a COVID test and we had no justification to show that we had a negative result, then I understand. Okay, put me up here. I deserve to be up here because I got nothing to show that I'm negative. But I have documents that stated that we took the test, we got negative results. So let me quarantine at home. Like my attorney says, I'm not asking to be roaming out in the public. All I'm asking is to let me go home. Let all these other people who have negative results, especially families who have a home here on this island, let them go home. Okay, let them go home. Nobody, unless you've been in our situation, you will never understand how it is. Yes, it's a 4 or 5 star hotel. It's beautiful, but my home is my palace. I can care less for this hotel. I can care less if this is a 5 star or 6 star hotel. I can only stay in this room for 2 or 3 days. That's fine. But for 14 days, come on. This is not a home. You know what a home is, or a house? It has everything. You have your appliances, you have your room, you can wash your clothes, you can cook, you can warm up your food. There's nothing in here but a refrigerator, 2 beds, TV, and a coffee maker. That's it. When my kids are hungry, I can't heat up the food. By the time we get our food here, Chris and Sabrina, by the time the food arrives at our front door, the food is cold already. Can you imagine letting it sit for a couple more hours after you're done eating and you have leftovers? Yes, we get breakfast, lunch, and dinner, but you have leftovers, right? So if the kids want to eat it later, it's cold. This is not a home. The governor keeps saying, stay-at-home order, stay-at-home order. Hello, Governor. This is not my home. I have a home. Let me go home.
Rach, it seems like your phone's probably going to be blowing up because there's a lot of people in quarantine. Have you heard from anybody else that are like, hey, I want to file a lawsuit?
So many. We've, since this decision has issued, we've been fielding calls left to right. People are reaching out to me on my private social media. And so I want to bring back to that point. You know, the court's orders, I'm taking it on a very legal perspective here. And the court agreed with us that 10 GCA 19605 requires certain things. And there has to be a written directive. Here, there was not. The last time we had a written directive was sometime in March. That has since expired. And public health did nothing to try to revive it, nothing to try to extend it. And all on the basis that they have this emergency health power, as if this emergency health power allows them to bypass the same the requirements that are contained in the same statute that they are relying on. Public health knew about these requirements. They undertook these requirements before. They've never done so again since March, but they still, in every public health guidance, in every executive order that we see, it cites 10 GCA 19604 and 19605. You would think that by now these guys would know it like the back of their hand, but even if I wanted to give them the benefit of the doubt, you know, they have legal counsel. They are the public health authority. They are constantly looking at these sets of laws as well as the information that comes in from the community about COVID. So they should be able to put together an emergency health plan. That also, by the way, is required by the law. I've not seen one. And the court says that this public health guidance, I keep trying to call it directive, but it's not. It's a public health guidance. I think the last one that issued was a revised 7. That is not sufficient for a written directive. So at some point in time, since around April to present, public health has been operating these government facilities for quarantine illegally. That's really the bottom line. And the court has found that by not complying with the specific requirements, these specific requirements are going to be things like giving incoming travelers notice about their rights, giving them an actual copy. It's not enough to just give them a fact sheet, but give them an actual copy of the law that requires that public health pay for their attorney. So Mr. Egros had to, you know, when he filed this, it was already about day 10 or day 11 by the time he got a hearing. But these travelers have a right to representation, have a right to a hearing, and also have a right for public health to pay for these things. That at the moment that they set foot in the airport and they're taken into custody, because this is what happened here. The court found there was no voluntariness in Mr. Egros's signed voluntary form. She actually did away with that. She said, there is no way that this is going to be voluntary. Everything is mandatory. Mm-hmm. There was no ability to give consent at all. So this is for Jean, and this is for every single passenger that has come in and been presented with this voluntary form and asked to sign it. And you know, the government argued. I'm thinking back on it, and the government argued, well, he signed this voluntary form, so he shouldn't be complaining about being in the facility because he signed that form. The court was pretty, you know, she responded pretty strongly. This findings of fact and conclusions of law, this court order is really, really strongly written, and the court understands. And by looking at that, I'm so confident that the court understands that we're not dealing with, you know, these little issues here and there. We're dealing with a huge civil liberties issue, and these are violations.
Yeah.
Yeah.
So how exposed are we? Are all the people who were held in the quarantine now? Are they going to be suing Go Guam for $1 million? Or what's the remedy?
So we found found that when we leave it up to the government, they're very slow to respond. They're very quick to respond when they're given a hefty fine for their violations. Because if Gene walks out of the hotel today, he'd be slapped with a $1,000 fine and possibly be charged with a misdemeanor that could carry a 1 year prison, a 1 year sentence. So I think that yes, to answer your question very bluntly, we are putting together an action for a group of people like Gene and everyone else who's come in since April without a valid written directive and without notice to themselves about their rights.
Okay, so class action. You said a class action lawsuit you're going to be filing.
We are working on that. Yes.
Okay, make sure you give me a heads up.
I will.
Please.
All right. Anything else, guys?
First, okay. I'm committed.
Right on. Gene, I mean, you spoke very passionately. I don't know if there's anything much for you to say. I agree with your comments. It's a stay-home order, so man, this is a totally different circumstance, but I've done the overnight with 5 kids in a hotel room, and it was supposed to be fun for a birthday. No, I can't even imagine 14 days, these circumstances, with a whole ass pandemic going on all around us. I feel not just for you, but for everybody who's been locked up under similar circumstances.
Bree and Chris, I wanted you guys to ask because I still have Dr. Uggin's interview in my mind. That was pretty mind blowing this morning. I'm just wondering, while there are budget, why can't we direct this money to War Memorial Hospital for them to staff up the hospital, their response for the actual medical care of people with COVID? I mean, to put together these COVID and non-COVID patients in a section with the danger of exposure and transmission to those without COVID, wow, that's pretty, that's pretty scary. That's pretty scary stuff.
I hear you.
Gene, thank you for coming on, sir, and we wish you the best of luck. And keep us posted. Shoot me a text if you get released, and maybe we could do a follow-up.
And real quickly, Rachel, where do people go? Because we keep getting messages. Where do they go if they want to join this class action?
They can contact me. So you guys have had the only other attorney that's challenged the quarantine orders here, Attorney Tom Fisher.
Yeah.
I contacted him over the weekend as well and asked if he was interested in working with me. And I work very closely with him for the past 5 years now. And they can either contact his office at 472-1131. My office is 989-0559. I've got my own office now. And so they can also email us at office, OFFICE, at Guam Council, GUAMCOUNSEL.com.
All right.
Thank you, Rachel.
Thanks, Rach. Thanks, Gene.
Gene, thank you, Gene.
Thank you. Thank you, Chris. Thank you. Thank you, Sabrina.
All right. Stay safe.
And you're in our prayers, man. Okay.
Thank you.
See you guys. Wow.